from Chicago, Illinois, slash, I spent some time in Los Angeles also. And the reason for my treatment is that I've been dealing with a rare liver disease, which caused me to become a diabetic, and also it's affected my kidneys and just overall daily wellness. And I was placed on a kidney and liver transplant list. So I decided to research and come and do stem cell therapy in order to try to avoid having a kidney and liver transplant, because I don't want anybody else's organs if I don't have to have them, and I don't want to go through the process of taking anti-rejection medications for the rest of my life. So I heard a lot of good things about stem cell therapy. A good friend of mine recommended it. She's taken her father, who was stage 4 cancer, to have stem cell therapy, and even after the doctors told him to go to hospice and there was nothing else they could do for him, after a few treatments of stem cell therapy, he's now cancer-free. The trip to Tijuana was good. I flew into Los Angeles and actually drove to Tijuana, and I had been here before, but I hadn't been this deep in the city. But you know, it seemed like a decent city, a normal everyday city. They have their traffic. They have people going to work, and hardworking people, and it's a nice city. It's different from the U.S., but it's a great city. I'm sure there are a lot of tourist attractions. We're going to go and try to go to the beach after we leave here, and check out some of the sights of Tijuana. It's great. The staff has been wonderful, even since the process of me contacting ProGen about my illness and whether they could help me. The staff has been in touch with me. I've sent them my labs. They've been, accommodating. They've explained everything the way, to make it easy for me to understand. And it's just been wonderful from the intro to the doctor and everything. Well, I have, it's called congenital hepatic fibrosis. So I have like a scarred liver. I was born with a fatty liver, and as I've gotten older, it's revealed itself more. So it's a form of cirrhosis. Usually you get cirrhosis from drinking or hepatitis, and I have neither. I don't drink like that. But some of my symptoms have just been not feeling well, not energetic. I've had confusion. Then from the diabetes, high and low blood sugar, and it's affected my kidneys. My creatinine has been high. So a day after, I'm feeling a little bit better. I'm feeling more energetic, and I'm looking forward to seeing, what else comes. It's going to take a little time for everything to become, more effective. But right now I'm feeling very good. I would recommend everybody to try stem cell. I'm an advocate for alternative methods of healing and of treatment, and I feel like a lot of the doctors that are in the U.S. medical system, they only have one way of trying to treat things, and there are alternative ways of treating things and alternative ways of helping people beyond medication. So, I would recommend anyone to come and try to have stem cell therapy, try to just check out alternative ways of healing. But this is one of them, and I'm sure eventually more people are going to do it. But right now, if you have any type of chronic illness, that you feel like there's no hope for, I would recommend investigating stem cell therapy and giving it a try.